Hi, my name is Kimberly and I do videos on my experience with chronic illness and searching for a cause and cure of my mystery symptoms. So please do have a look at my previous videos if you haven't already. Today I am going to be discussing my experience with antibiotic treatment for my Lyme disease and co-infections. So basically I was eventually diagnosed with the Lyme co-infections rickettsia, two different strains of rickettsia, and mycoplasma pneumonia, chlamydia pneumonia, and Epstein-Barr is one of my infections as well. I don't think it's that significant though, the Epstein-Barr, but it does add to the body's load, of course. So those are my official infection diagnosis. But actually recently I was told that my initial test for Lyme disease was a false negative, and I actually do also have Lyme. So that was a surprise. So I do also have Lyme. But I want to make a point that Lyme isn't the only infection that can make you really sick. I was bedbound for a very long time. I'm just going to start by saying that if you have been diagnosed with a disease such as an autoimmune disease, chronic fatigue syndrome, fibromyalgia, multiple sclerosis, or any disease really that the doctor can't really tell you why your body is reacting that way, or the cause, like what actually triggered it and what actually caused it, you need to question further and you need to search a little further, because often these diseases just have labels and doctors say, okay, you're going to have to take medication for the rest of your life, and they don't really tell you the underlying cause. Modern medicine isn't designed to do that. They're designed to just prescribe you pills and then send you on your way and hope that your symptoms sort of subside. But for me, that just wasn't good enough. I feel like I'm young and I should be healthy and I live a healthy lifestyle, and I wanted to reach optimum health naturally, or I want to eventually have my body functioning naturally in a healthy state. So if you have been diagnosed with any of those illnesses or any illness that you still question and you want to know why, I would look a little bit further into it if I were you. Please have a look at my other videos. My symptoms video, you might be able to relate to it. My story, you might be able to relate to, and my treatment and recovery options as well. And I'm going to be posting a lot more in the future. So let's get into my antibiotic treatment experience. I started antibiotic treatment last June, so June 2017, and basically the only way to treat with antibiotics is the way that I was treated. A lot of people say that antibiotic treatment didn't work for them, or antibiotic treatment doesn't work. Well, in my opinion, it only makes sense that antibiotic treatment would work because you have bacteria. Antibiotics kill bacteria, so that's probably the best way to kill your infection. But the reason why it doesn't work for so many people is because their doctors aren't doing it correctly. This is a very evolved disease. They have amazing survival tactics and they are highly intelligent actually, so they can adapt and evade treatment. So basically what you need to do is you need to treat with pulse therapy. So basically that means that you'll be on antibiotics for 1 week, and it will be high dose antibiotics, and it won't just be one antibiotic. It won't just be doxycycline, for example. You'll be on a combination of antibiotics. So one will be a cell opener and the other will kill the infection. So basically, I'm not scientific or anything like that, but to explain a little bit better, I am going to link a book below that gives you amazing information. It's really informative. It really helped me understand a lot better, and there's just so much information in there that I couldn't possibly put it into a video. But what you do need to know is that the bacteria hide inside of cells and they protect themselves. So you do need a combination of antibiotics, one to break through the wall and one to kill them. That's as best as I can explain. I'm so sorry. Okay, so I did this for 11 months. 1 week on high dose combination antibiotics and then 3 weeks off. There are guidelines as well that you have to do this under. Obviously, you have to detox a lot and you have to take probiotics at least 2 hours after your antibiotic dose so that the antibiotics don't kill the probiotics, because obviously it's very harsh on your body, but in my opinion, it's so worth it. I would much rather go through this harsh treatment than feel the symptoms that I was feeling before. I couldn't get out of bed, I couldn't live life. It was absolutely miserable. But unfortunately, on the antibiotic treatment, your symptoms do amp up significantly. So now that I've discussed why some people are under the impression that sometimes antibiotics don't work and that they need to be done in a very specific way, I'm going to go on to my personal experience on the antibiotic treatment. So my first course in June, I think it was doxycycline and Cipro. I can't say the full name of the Cipro. I'm sorry, I'm so bad with medicine pronunciations, but I think that was my first combination. And I was home in South Africa at the time for 3 months. So the first 3 months of my treatment, I was home in South Africa. And the first course of antibiotics, it actually wasn't so bad. I think that it gets worse as it goes along. You're advised to drink at least 3 liters of water a day. You're advised to do many things. You have to kind of like keep your blood moving by exercising so that you can detox, and you're supposed to sweat in a really hot bath. Unfortunately, I was in Cape Town and they have water restrictions, so I couldn't take the hot baths, but I did try to detox as much as possible. On the first day of my course, I felt absolutely fine. I felt like this is going to be so easy. But then on the second day, like 2 hours after I took my dose, I started to get like a burning sensation up behind my back and all the way up like behind my skull and up my head, like on my brain. It basically felt like my brain was on fire and my back was on fire. And then I started to get like a fast heart rate, and I felt like very floaty and dizzy. And I felt like I was just like tripping. Like I was like, this is like terrible. I feel like I am on like hectic drugs, which I was. So that was really an eye-opener. But then strangely on the third day onwards, it was fine. I felt okay from the third day onwards. And then about a week after I finished my first week of antibiotics, so remember I only do it for 1 week and then I'm off for 3 weeks, so I was off the antibiotics now. And about a week later, I started to feel like a head cold, like I was getting the flu. I had like really, really stuffy sinuses, and I just felt like I had the flu or like a head cold. And then about like a week or 2 after that, so this was like 3 weeks after I had finished my first course of antibiotics, I got a chest infection. And I thought that these weren't linked, but apparently that is really common. It's basically just your infections playing up and kind of like fighting back. So that is quite a common reaction. Then I went on to my next course after 3 weeks break. I went on to my next course for 1 week, and that was 2 different types of antibiotics. I can't remember exactly what it was on my next course. I think it was flagyl and tetralysal. It was flagyl and tetralysal. So that was my next course in high doses. And actually during the course, I felt fine. Once again, I felt fine during the course. It was about a week later that I got really, really bad stomach cramps and nausea, and like I needed to go to the loo a lot, and I just felt awful. My heart rate was like really high and I felt like just horrible. So I called the doctor to come to me. I couldn't get out of bed, and he told me that I had really bad gastritis. So I was then diagnosed with really bad gastritis, but actually subsequently a few months later, when I spoke to my doctor, I found out that it is just a reaction to the medicine. I will explain this a little bit further on. Then after my next course, now I really can't remember what my next course was, but after my next course, it's a different combination of high-dose antibiotics for 1 week. This was now my 3rd course. I started to feel really bad, like really, really bad. After that course, I got a temperature a very high temperature and very low blood pressure. And I just felt so weak that my doctor told me to go to the hospital. He said that he thought maybe my blood pressure had dropped too low, because he came to me the night before and my blood pressure was really low, my temperature was really high, and I was just feeling something wasn't right. And so he told me to go to the hospital, and the hospital said that they couldn't really find anything wrong. They gave me fluids, IV fluids, but they said that I would be okay and nothing was really wrong. So I thought, that's really strange. And I didn't have any support. I didn't know anyone who was going through this. I wasn't a part of any support groups yet. So basically I just had to deal with it on my own. And I thought, what the hell, like, is this normal? Then I came back to Abu Dhabi, and as the courses went on, I started to get more reactions during the courses. Like during the week of antibiotics, I started to get really bad reactions. So a few hours after I took the antibiotics, I would get like a really bad reaction. Like my heart would go really fast. I would get so hot. I would sweat. I would get anxious and panic. I wouldn't be able to breathe. I would be shaking. I would be thirsty. I would have head pressure, dizziness, feel like I'm floating. I would actually be like holding onto my bed thinking that I'm like floating up. It was like the most bizarre feeling ever. Headaches. It was just absolute hell. I couldn't see straight. I couldn't think straight. And basically I would just sit in my bed trying to pass the time, waiting for the day to be over so that I could try and get some sleep and just escape this hell. And basically I would just sit there like trying to survive. I would just be like, okay, like talk to myself. I would talk to myself to try and just reassure myself that I'm not on the verge of death, because I literally felt like I was on the verge of death. Like if that's not what death feels like, I don't know how people actually die. I tried to be strong, and I told myself, no matter what, I am going to go through this. No matter what, there is light on the other side, and this is what needs to happen in order for me to get better. So I tried my best to be strong, and each course that came, it got worse and worse. And I would run to the hospital. I would beg them to test me, my adrenals, test my kidneys, test my liver. I thought that something was seriously wrong, and everything always came back normal. So I had a Skype appointment with my doctor, because she's in another country, and she said, yes, this is a Herxheimer reaction. It's normal, it's necessary. Basically what happens is when the bacteria die, they release a chemical, and also they don't go without a fight, so they are fighting for survival as well. But when they die, they release a chemical that it's basically like toxins, and your liver can't detox quick enough. So it's basically like you have a really bad hangover. I think that's the best way I can describe it, but you have to assist your liver in detoxing as much as possible. And the best way to do that is in between your treatments, meaning in between your antibiotic courses, you can take supplements and you can take things to really assist your liver to make you strong for the next round. And I would also suggest, well, you absolutely should take probiotics constantly, even if you're not on the antibiotics. All the way through, you should take high-dose probiotics. But I am going to do a video on how to get through antibiotic treatment. Okay, so then I found support groups online on Facebook, so that made me feel very relieved, and obviously I didn't feel as isolated and I felt more comfortable, but it did not minimize the fear and the anxiety during every course, because I still felt absolutely terrible, like I was dying. And when you are in that state, there is nothing that will minimize your fear and anxiety. There's nothing. So I eventually went onto a course that was dapsone and tetralysal. Dapsone, if you don't know, it's like an anti-malarial drug, and I think it's also used for leprosy. So it's a very strong and specific drug, and I suspect that I have the infection Babesia. I haven't been tested for it, but I suspect that that is one of my infections, and I do actually treat for it. But this targets Babesia, dapsone. So basically what can happen on dapsone is you can get a reaction called, I'm going to put it up on the screen because I can't say it, but I'll put it up on the screen so you can Google it. So this is the reaction that you can get from dapsone, and basically what happens is you don't produce enough cells that transport oxygen around your body. So you will have oxygen in your body, but it's not being transported around properly. So my oxygen was at like 90%, and usually my oxygen levels, even if I feel like I can't breathe, usually they are fine. They're like 98%, 99%. But this was 90%, which is quite a low oxygen level, and I felt like I was drowning. My heart rate was at 160. That's just sitting, lying in bed or sitting. I actually sat up because I felt like when I lay down I was just gonna die. I don't know. So yeah, if you can imagine the feeling, I felt like I was being dunked underwater and someone was holding me. So I panicked. I obviously went to hospital. They didn't have the test for this condition because it's like really rare, and it was one of the worst days of my life. I honestly thought that I was dying. I was saying goodbye to the world. Anyway, so the hospital wanted to hospitalize me and keep me on oxygen and just monitor me, but I said no, I just want to go home and sleep. So I went home and I tried to sleep, but I couldn't sleep because I felt like I was drowning. And so I went back to the hospital until my oxygen kind of stabilized. Something that did help me was the IV fluids and vitamin C. They told me to take high dose vitamin C, and that actually worked. And IV fluids, I think maybe it was flushing the medication out of my body or something. I'm not sure. That's just my own theory, but it improved from that. So I stopped the dapsone and I continued with the tetralysal, and it was still really, really, really difficult. I went into like a weird depression. I felt like very depressive, and I felt always cold, like I would shiver, like I was like shaking and shivering, like very hectic tremors. It kind of looked like I had Parkinson's, which by the way, they say that Parkinson's is also caused by intracellular organisms, interestingly enough. And also I still felt like I couldn't breathe properly, but not to the extent of when I was on the dapsone, and my heart rate was still really, really high. So I finished the course of tetralysal, and as soon as I stopped, things started to clear. And it actually, in hindsight, was what was necessary for me to recover. I think that the bacteria were just playing up, and a good analogy for this is that it's like you're trying to get bees to come out of a beehive and you hit the hive. So when you're taking these antibiotics, you're like hitting a beehive, and then there's going to be extreme chaos for a while, and then everything will calm down a bit eventually. But I think it depends on the individual how long the chaos lasts. So for me, it was like 11 months until it calmed down. So 11 months of pure torture, 11 months of pure hell. But I learned so much during those 11 months. I really cherish my health, and I really cherish the small things in life. So now that I am a lot better than I was, and I can actually go out during the day and do things. When I was on antibiotherapy, I couldn't do anything. I was basically in bed all day. I couldn't even wash myself, if you can believe it. I couldn't even get up. Going to the toilet was like the biggest task ever. And it was really difficult because I had to drink a lot of water. So you can imagine how difficult that was. I would like crawl to the toilet. It was absolutely awful. I never want to go back there again, ever. It was the hardest thing I've ever had to do in my entire life. And I really mean that, because every day when you feel like you're dying, it's like complete torture. It's really traumatizing. I'm traumatized. I am traumatized. I don't want to see another medicine in my life again. Okay, so now basically that I am better and I'm able to do things, I've decided to go onto a more natural treatment, and I am going to do a video about that coming up. One thing that I want to mention is that I might have stayed on the antibiotics if my doctor that's treating me was more attentive. She's like a very, very, very busy doctor. She has patients from all over the world, and when I was going through my episodes when my oxygen was low and everything, she never helped me like at all. I would WhatsApp her and she was actually kind of rude back, and I think that she gets rude because she's been treating people since the 80s, and we all probably feel like we're dying and we're all probably WhatsApping her. But for me, that was really scary because I was on like these so-called dangerous meds, or I thought that they were dangerous at the time, especially when I thought I was dying, and she wasn't there for me. So I just don't know if I can go through with more of those episodes without support from the person who has knowledge, the person who prescribed them in the first place and should have knowledge on them. So I'm going on to a more natural treatment. I actually have just started it and I'm going to do a video on it soon. It can still cause a Herxheimer reaction. Basically, if you don't get a Herxheimer reaction, your treatment's not working, because when the bacteria die, they are going to cause havoc within your body. That's something, it's a necessary step that needs to be taken for your treatment. So I'm okay with that, just as long as it's not just too overwhelming. Eventually I was crying when I had to take my antibiotics. So for anyone who is considering going on antibiotherapy, I don't regret it. I think it's really a necessary step. The fact that I had such strong reactions was because the bacteria were really being hit really, really hard, and I really needed that. And I'm really glad that I did it, and I'm so glad that I made it through, and I'm really proud of myself. It like teaches you strength and self-discipline and all sorts of lessons, and patience, especially patience, because you have to really be patient. So I would really advise it. Just be prepared and do lots and lots and lots of detoxing. I never got an infrared sauna that will make you sweat. I think that would have really helped me. So if you are able to do that, definitely get one. I am going to do a tips video though, so I'll keep a lot of tips for that video. But there are things that you can do to make it easier for yourself. So I would recommend it. Just be prepared for a really tough ride, and just know that when you are going through those tough times, that it's a necessary step and you will most probably be okay. And especially if you take the tips that I am going to be posting soon, you will be okay. And if you are busy going through it right now, I just want to say stay strong, push through. There is light on the other side, and it is going to work, and you are going to get better, and you are going to find health and happiness very soon, and you are stronger than you know. And I have so much respect for every single person who has gone through this treatment. You are absolutely amazing. Thank you so much for watching, and